I'm Lois Mattern. I'm from Beavertown, Pennsylvania, and I am 59 years old. The moment I knew I had to have a hip replacement is when I finally went up a flight of stairs and I couldn't get up. I lost control of my left side, and while knowing in the last several years that I was going to have a hip replacement since it runs in my family, the moment it was so clear, I could not move my left side. My family care doctor is Dr. Chris Darrop from Family Practice in Middleburg. My surgeon for my total hip replacement was Dr. Thomas Dominic out of Sun Orthopedic. And from there, I went to Evan Hospital in Lewisburg. I was told then that I would be hearing from a representative of Evangelical Hospital to attend a seminar, and at which point my husband and I did attend the seminar, and we were given an entire tour of what was going to happen from the moment we registered to come in that morning. We received enough reading material to pretty much walk yourself through the surgery. And I felt very comfortable while I was hesitant about the surgery, since it's a little scary. I did go in feeling very confident, not only of my surgeon, but also of my care team. When I woke up from surgery, I was surrounded by nurses, my husband, of course, and my surgeon, and I was told that they would be back in just a few hours to get me up. The very next day we had a class, and we met a lot of the people who were in our informational seminar, and we immediately started therapy. I was bending my leg, I was moving back and forth, I was being taught how to walk. When I did get home, I received a phone call, and it was a nurse by the name of Kathy who said, "I am going to follow you now and help you along the way." And I'll tell you right off, I felt comfortable, I felt cared for, I felt that there was going to be someone to follow me, to help me, to put me at ease, and to walk me through what was happening to me. Right away she asked me about my meds. And I was a little confused about my meds because I know what I take on a daily basis, but then I had been on Coumadin therapy, and I wasn't quite sure about what's Coumadin all about and why. And yes, I know that was all explained to me in the hospital, but when you leave the hospital, you're confused, you've got a lot ahead of you, and especially when you've had a joint replacement, all you're worried about is, how am I going to move? So I felt that what a wonderful relief knowing that someone was going to help me through, especially on the medication aspect of it. And at one point I did tell her that I was having a problem, and she couldn't answer me right away, but she did tell me, "Look, I'll get back to you, I'll research the problem, and I'll call you." Within 2 hours, she had researched the questions that I had and the after effects that I was having from a certain medication, and actually contacted my doctor, who ordered up another blood test, and they actually changed a little bit of my medication and what time of day I should be taking it. My overall experience with the program, and the way I would like to put it in its place, was I felt that it encouraged me on a daily basis. I knew that if I ever had a question, I could contact Kathy. She gave me her home number, her cell number, her office number. I knew that someone was following my progress. I would absolutely hope that should anything happen in the future, and especially when I go to have my next hip replaced, that she'll be there, or someone from her program will be there, because it is absolutely a feeling of confidence and care.